Have you ever wondered why swallowing feels impossible for some people? Yes, some people might find it difficult to swallow for various reasons. But imagine trying to pass food through a narrow passageway that just refuses to open up. This is what happens with a condition called achalasia, which is a not so common but impactful condition that can cause swallowing difficulties. So if you or someone you know has been dealing with swallowing difficulties, this video may be the one for you. Hi, I am TheWhizDoc, a board-certified family medicine physician, and I talk about a wide range of health topics, hopefully to enlighten you more about medical conditions so that you can make the right decisions about your health. So let's get right back into the video. Did you know that achalasia is a condition that affects 1 in every 100,000 people every year, and that most people diagnosed with this condition fall between the age groups 25 to 60? If you knew these facts, please let me know in the comment section. Although not so common, I have been part of the treatment team for individuals that presented to the hospital with various swallowing complaints. And I have had a patient that was actually diagnosed with achalasia. So yes, I have seen this firsthand. Also, I have seen people on social media post videos like this and this, sharing their stories on social media to help raise awareness about this condition. If you or someone you know has been affected by achalasia, please share your stories in the comments below. We would love to learn from it and help raise awareness. So what is achalasia? This is a disorder that affects the esophagus, which is the tube that connects your mouth to your stomach. So food passes through your mouth, through the esophagus, into the stomach. With achalasia, the lower part of the esophagus does not work normally, and the sphincter refuses to relax. So this creates like a blockade, a barrier, so that food is unable to find its way through the esophagus into the stomach. So just like I said earlier, imagine having food pass through a narrow passageway that is blocked and prevents the food from passing through. That is what we see in this condition called achalasia. It can affect not just foods but also liquids, and it can lead to complaints or symptoms like chest pain, regurgitation, vomiting, and in some cases it can cause severe weight loss. And over time, due to this obstruction, the part of the esophagus that is proximal or just before the part that is blocked begins to expand, dilate, and swell due to an accumulation of food and saliva as a result of the blockage. The most common symptom associated with achalasia is difficulty swallowing. The most common complaint is people coming in with concerns that they have this sensation that something gets stuck in their chest whenever they try to swallow. Foods and liquids can cause this symptom. This condition tends to start slowly, but over time it progresses and gets worse. Unfortunately, most people with this condition do not present to the hospital or to the doctor's office early enough because they make adjustments on their own to help with the symptoms. Some of these adjustments are eating small amounts of food, or chewing completely, or eating very slowly, or altering their diet to something that is softer, or even liquid diets to help with the symptoms. And sometimes they could try maneuvers like moving their necks around, adjusting their shoulders and back around, just so that they can try to open up the esophagus to help the food go down easier. So with this condition, it can be frustrating and it can actually get really scary. But there is some good news. This condition can be managed. One of the ways that we diagnose this condition, or possible diagnostic methods, is an x-ray. So with the chest x-ray, you might be able to see the esophagus being dilated. Remember earlier I mentioned that with the blockage, above the blockage you have parts of the esophagus swell and dilate, and you have accumulation of food and saliva. So in some cases this can easily or can be seen on x-ray. We can see the dilation of the esophagus, but it's not really diagnostic, and not everyone will have this finding on the x-ray. Another more reliable test is called esophageal manometry. This works by actually checking the muscles or evaluating the muscles of the esophagus by checking the pressures within the esophagus, and this is actually more diagnostic. With this test, a tube is passed through the nose or mouth into the esophagus to measure pressures within the esophagus, and it can actually help us confirm this diagnosis. You might also have another test called the barium swallow test, which is a common screening test, which involves you swallowing this chalky tasting mixture of barium, and an x-ray is done. And we have this characteristic finding called the bird's beak appearance, which pretty much means the shape of a bird's beak, with the narrowed end, which is the part that is blocked or narrowed, and then above it you have this swollen, expanded area of esophagus, which is the dilated part that I mentioned earlier. Sometimes you might see other areas within the esophagus that have contractions, but not all the time. Also, your doctor may recommend a procedure called an upper endoscopy to help visualize the esophagus, the lower esophageal sphincter, and possibly the stomach. Usually this is done under anesthesia and can be recommended in those that have suspected achalasia and also to rule out other conditions including cancer. There are various treatment options available, but the truth is that none of them can help reverse the damage already done or stop that ongoing nerve cell loss within the esophagus. But they can help improve the symptoms and improve the quality of life. These treatments work by weakening or opening up the muscle fibers within the esophagus to allow food pass through easier into the stomach. Medication is the least invasive option. Medication like nitrates and calcium channel blockers, although for some people they're not effective, especially with the possible side effects. While for some others, over time it loses this efficacy, but it is recommended for those that are not interested in having surgery or for those that are not healthy enough to have the invasive procedures or have surgery. Did you know that Botox injections have been used to manage this condition? So what happens is the Botox injection helps to paralyze the nerves that cause the muscles of the sphincter to contract. So they end up relaxing and helps to relieve the obstruction so that food can pass. And this is typically done during an endoscopy. Usually it's for short-term relief and you will require multiple sessions once it begins to wear off. And it has been seen to be more effective in those that are above the age of 50. One of the invasive procedures is called the pneumatic dilation, which involves passing a tube with a balloon down the esophagus to the part that is narrowed, the esophageal sphincter, and the balloon is expanded to help open up that narrowed area. This procedure actually helps some people, but for some others, they will require multiple sessions to get proper relief. Another procedure is a myotomy, which is a surgical procedure that is done to help weaken or open up those muscle fibers. And this can be done via laparoscopy. For some people, they think that this is a more definitive treatment when compared to the balloon dilation, the Botox injections, or medication. Unfortunately, since none of the available treatment options can cure this condition, regular follow-up appointments are important and recommended because this can help identify and treat any recurrent symptoms and also manage any complications that arise as a result of the treatment options that are explored. This is because identifying and treating this condition early can help prevent the development of this severely distended or enlarged esophagus and in some cases esophageal cancer, which will require a complete removal or resection of the esophagus. Are there any lifestyle habits or tips that you can implement to help with your symptoms? The answer is yes. Just like I tell my patients, for those diagnosed with achalasia, living with this condition will require you to make certain changes or adapt your daily routines and habits to help manage these symptoms. So let's talk about some of these adjustments you need to make. Firstly, changes to your diet can make a significant difference. Eating softer foods that aid with swallowing can actually help. Think about foods like soups, smoothies, and even well-cooked vegetables. You could also take small bites, eat slowly, and chew your food thoroughly to help aid with the swallowing process. Staying hydrated is also important. Try to drink fluids like water, which can make it easier for the food to pass through the esophagus more smoothly. But here is a pro tip. Avoid drinking large amounts of fluids or water with your foods, as this can make it more difficult for the food to pass through. So we talked about eating and drinking. Now we can talk about some other lifestyle adjustments. Try to sit upright when you eat and also wait an extra 30 minutes after you eat in the upright position, because gravity in this situation can be your friend. Gravity can help with the food going down into your stomach. And also avoid trying to eat your food very close to bedtime to avoid regurgitation and vomiting during the night. It can be very uncomfortable at night if you eat very close to bedtime because the food gets stuck in your esophagus. Living with achalasia might mean that you have to adjust your emotional outlook. Yes, it is normal to feel frustrated or isolated sometimes. This is why it is important to seek out or connect with social groups or social support groups. This could be online or in person that can provide you invaluable tips and support from those that actually understand what you're going through. Remember, you're not alone. It is important that you are seen by a healthcare provider that understands this condition and how to manage it. Closely follow up with your healthcare team so that they can figure out treatment options that are unique to your specific situation. Together, you can explore the best treatment options that will work for you. Dealing with achalasia can be a journey, but with the right care, there's hope for a better, more comfortable future. Do not hesitate to reach out for help if you need it. Thanks for watching. For more medical videos and health tips, please hit the subscribe button and the bell icon so that you do not miss out on future videos. I am TheWhizDoc. Thank you for watching. We've come to the end of this video, and I will see you in the next one. Your health journey matters to us.